Yeah. A very warm welcome to all of those present here today. And to lead this session today, we have.
Hi.
Hi, sir. Hi. You're finally able to log in, sir.
Yeah.
Okay. So we have Dr. Ripal Shah as the chair of today's session. And Dr. Ripal is a senior rheumatologist in Baroda, along with Dr. Jeet Patel, who's another rheumatologist from the same city of Baroda. And Ripal sir, possibly you can take over from here.
Good evening, T. Good evening to all of you. It's a privilege to introduce one of the most senior allergy immunologist, uh, Dr. Pudupakkam Vedanthan. He is a board certified immunologist, allergist working since early 70s, a very, very long time. And in addition to his private practice, he has been always involved in academic medicines at University of Colorado, Denver Department of Medicine and Division of Allergy, Asthma and Immunology. He is a founder chairman of International Asthma Services, an NGO which works in improving care of patients with asthma and allergy and works in USA, India, Kenya, and many other countries. He has also worked as established as a co-director asthma allergy training program at CMC Vellore, and this program has attracted a national and international recognition and has been replicated in other institutes also. He is the lead editor of three global textbooks of allergy, and he has been awarded an International Teaching Award and Excellence in Global Health Award by University of Colorado, Special Recognition Award by American Academy of Allergy, Asthma, and Immunology. Uh, it's a great uh, pleasure to listen and learn from such a distinguished faculty about the integrated approach to allergy and asthma. Uh, the now the time is yours, sir. Please
Thank
enlighten
you.
us.
Thank you, Dr. Ripal Shah, for this kind introduction. Can you hear me?
Yes.
Okay. I'm sorry I had a little technical issues signing into the Zoom. That's the reason I'm a little bit delayed. So let us move on because of the time factor. So this particular topic is actually a very unusual topic that we would be addressing. But at the same time, this is a very important topic. This is something that we should be aware of because it is being commonly encountered in clinical practice by all of us in all different fields, not just allergy, immunology. In every field, there is this particular issue comes up. So we need to be aware of what's going on. And let me just look at some certain definition. I don't know why that particular line is there. I don't know. But anyway, complementary medicine, alternative medicine, integrative medicine, these are common terms that we address to these type of issues. But when you say complementary medicine, it's a non-evidence based type of medicine that is combined with or used along with conventional medicine that we are all trained in allopathy physicians. Alternative medicine is an approach that is used in the place of conventional medicine. Many times the conventional medicine is stopped and this is used instead. But integrative medicine, that is the one that is gaining ground among both fields of medicine. Is this is a combination, and integrative medicine is an evidence based approach from both the fields, both from the traditional medicine as well as the conventional medicine. So this is where we are heading to gradually. And integrated approach is probably the way of the future. It's probably the way of future because we are encountered with a situation where, in spite of all the knowledge we have gained in Western medicine, with all the evidence-based medicine approach that we have been using, if you look at patient satisfaction, it is not very, it is good, but not great. Not great. So there is quite a bit of concern among patients and families about several issues of the type of medicine that we are trained in. That is one of the main thing is side effects. People are quite concerned about side effects. Another one is access. Another one is the cost of it. So these are issues that, and also because of the huge demand and also lack of training, there is a definite lack of holistic approach. Patient feels, oh, the doctor did not spend much time with me, so I don't know whether he knows or whether he really understood my problem or not, but he gave me all these prescriptions. So lack of holistic type of approach, personalized approach is absent or at least lacking. So because of this, the public is looking for an answer, and that is the reason why they are seeking care at alternative places. That is why it is called alternate medicine. Now, if you look at, is this a problem just in a few countries? No, it's a worldwide, it's a global problem. It is present everywhere. Every country has this. It's not just like India, Europe, or USA. Every country has this. So if you just look at the scenario in the Western Europe, more than two-thirds of patients in Germany use complementary medicine. But actually, the complementary medicine has not been getting a lot of support before, but now people have realized that this is an issue that they have to pay attention. So there is getting more and more support in places like Germany. Now, if you look at the UK population, there are about 10% of people use complementary medicine, but out of them, 50% are lifetime users. And if you look at the number of citations that are um, used or quoted, very few are evidence-based. So that is the main issue that we are facing now. Now, in Western Europe, it is variable and challenging. That is, it is widely used across Europe, but still there are certain issues that is still not recognized. There is still resistance from the state as well as the medical profession, the traditional medical profession. There is some opposition in all these places, but still, in spite of that, it is gaining ground. For example, acupuncture is very popular in France. Manual therapies are quite common. Chiropractic, osteopathy, massage, mind-body practices, all gaining ground. Actually, what happened was I was in Jerusalem for a meeting many years ago. And what I presented was the yoga techniques that we used, yoga breathing techniques. I'm going to briefly talk later. Yoga breathing techniques in asthma. We presented a paper, and that was very well received. But what happened after the presentation for the next 2 days? I was interviewed as well as I was followed by many physicians, mostly from Eastern Europe, mostly from people from Poland, Russia, and all of these people were very, very interested. And later on, one of the doctors, actually from Austria, continued to keep in touch with me and started actually his own the complementary medicine type of clinic in his town. So there is quite a bit of interest in all these places, and it can vary a lot. Now, what is the scenario in USA? In scenario in USA is the government has been quite sensitive to this issue. They found that there's a huge amount of public interest. There are many, many millions of people seeking help. So because of this, they actually, under the umbrella of National Institute of Health, which is like a major organization managing all the healthcare facilities across government controlled, including lots of grants, NIH grant, you must have heard of it, where there's a huge amount, millions and millions of dollars are given as um, grants, research grants, they opened an institute separately called Institute of Complementary and Alternative Medicine under NIH in near Maryland, near Washington, D.C. And that is where a lot of work has been done. Actually, it is not surprising if I say more research is done in Ayurveda in USA than in India. But now it is Indian situation is getting better and better with this Ayush coming. But all these years, more research have been done in Ayurveda. And also another place of research that has been significantly reported has been traditional Chinese medicine, which we are going to talk more later. But herbal medicines in Europe were banned. Now it is available. So a lot of these things are happening across the world. Now the latest survey, the American Academy of Allergy wanted to know what are the allergists doing with this type of situation. They found incredibly surprising data. One, 80% of the patients from in the allergy, I'm talking about allergy patients. According to the Quad AI survey reported, it's a published data, results of a nationwide survey of allergists, 2018 JSCI. 80% of patients utilizing complementary alternative medicine. 60% are experiencing some sort of side effects. Some are significant, some are quite moderate, some are quite serious, including anaphylaxis. And physicians are not trained, that is, allergy doctors like us are not at all trained enough to administer proper history. We don't know how to take a history. We don't know how to manage these patients, how to talk to them. We don't know what are the questions to ask. We don't know. We are quite ignorant about it, but our patients are taking it. And so we need to educate ourselves first. More than educating our public, we need to educate ourselves about what to do with these patients. What is this complementary medicine? What is the Ayurveda? What is herbal medicine? We need to get some basic facts about it. And then we will be in a position to address these issues. Now, a survey, the same survey that was continued, they wanted to know what are the products our patients are interested. 67% of the patients were interested in herbal medicines, 62% in vitamins, probiotics 57%, fish oil omega-3 57%, echinacea, which is a herbal medication, I think is given for depression, 38 to 40%. And mind-body medicine, if you take yoga, 52%, acupuncture, 57%, meditation, 41%, prayer, 48%, relaxation, 37%, deep breathing. So all these things are going on along with the traditional medicine that we are using, and along with the established medicine, Western medicine. These things are happening. 60% of our patients are taking it. Whether they tell us or not is a different issue. Now, if you look at the adverse events that have occurred because of this, 23,000 emergency room visits have occurred in the US per year because of these complementary medicine side effects. 80% have discontinued the conventional treatment regardless of the physician's advice. Even when I say, no, please continue with your medicines, 80% of these people who have started it will just stop our medications that we are given based upon evidence. And most of the people who are taking it, they take their recommendation not from us, they take it from their friends, families, neighbors, media. And because we do not ourselves know very little about this complementary medicine, we ourselves do not know. And 96% of us physicians who answered this survey did not know how to take a good complementary alternative medicine history. So the Quad AI came out. After doing all that, they came out with some intake forums. This is an intake forum. It is called Integrative Health Intake Forum. How to take the basic questions that you have to ask. You can modify depending upon the situation we are in. But this is a basic format template that you could use. And I'm going to have Kunal distribute this. As well as Integrative Health Index is like a check mark for both natural products, patient administered, natural products. So there's a whole bunch of them. Many of them you may not even have heard names of it, but you need to start doing this type of thing with your regular history physical, because that's the only way we will know whether our patients are taking these alternative preparations. Now, what indications are there for patients who are using? What is the indication in our specialty? Asthma, 60%. Allergic rhinitis, 76%. Eczema, 58%. Food allergy, allergy prevention, 42%. And overall health being, I want to feel good. Another thing they say is, I want to improve my immune system. They say it improves your immunity. And that is widely used as an ad. This pill will help your immunity. And the people are sold on it. 71% use that. Now, actually, and that cuts across the population, irrespective of your educational and professional background. My own personal experience in my own town of Fort Collins, Colorado, where the general level of education is extremely high because of the university. It's a university town, just like university towns are very highly literate people, highly literate, PhDs all over the place. So I went to this PhD couple house for dinner. On the dinner table, there was food, but more than the food items, there were more bottles there, many different type of bottles. And I was wondering, what is this? What do you have on all these different bottles? And both were sort of swore by those bottles. They say this is good for this is good for that, this is good for immunity, this is good for your hair growth, and this is good for your skin. And these are two PhD couples, highly literate, and they are professors in the university. So what it means is, this issue can cut across the society, and even highly literate, educated people are also prone for this, because they are not happy with the type of approach that we are offering them. Now, what is the reason why they are using this complementary medicine? There are several reasons. One, they feel it is not effective. Then side effects, difficult to adhere to conventional therapy prescribed, like inhalers, for example, not easy. I don't know how many people you have, we give inhalers all the time. Every day we are prescribing inhalers to hundreds of patients. Have anybody, one of us, have tried taking it on a regular basis? Even when you feel good, it's not very comfortable. It's easy to swallow a pill or put a lotion on the skin. And that is why you have Thaila in Ayurveda. It's very easy. Just put the lotion, the oil, and that takes care of whatever it is. Herbal medicines. So the inhaler technique and many techniques that we use in our method are difficult. So we complain about low compliance because of that. So it is the mode of therapy is also important. And they always have a feeling that, oh, complementary medicines are natural. That's why it should be safe. Anything natural is safer than anything synthetic. So this is a built-in type of stigma in the society. So that also makes a difference. And these are the issues that ability to treat illness without seeing a doctor. That is something that is possible with complementary medicine. Oh, I don't have to go and see every 3 months. I don't have to pay 1,500 rupees consultation fee. I'm saving there. That's what the patient says. I don't have to go there. I get it in the mail also. So where can you get information about all these issues I'm talking about? There's a whole list of it right there. PubMed will give you. National Center for Complementary Alternative Medicine website. And there is another one in India. I'm going to share that with you later. So, what is the situation, integrated health scenario in India? In India, now we have the the government has come up with this Ayush program. A means Ayurveda, Yoga, Unani, Siddha, and homeopathy. It's a ministry. There's a ministry for it. I have not seen a country where there's a ministry for alternative medicine. I know there are major institutions, but nothing like a ministry where the state is involved in promoting this. And that is what is going on in India. That means this particular program in the next 15 to 20 years will flourish, whether you like it or not, because there's a huge amount of funds that are pushed into this. And all in aims are coming up with Ayush centers. Actually, I go to AIMS in Rishikesh. And actually, I also am a patient there. I go there because of some pain here and all that. I get massages and all that. I feel pretty good. So, and when I talk to those doctors there, they are well qualified doctors. They are not quacks. They are well qualified in their own fields. They are postgraduate and they talk sense. They actually talk sense. They know what to give, why to give, when to give. So many of these doctors are quite well educated as well as trained also. So Ayurveda, as you know, is thousands of years old, and now it is gaining. It lost a lot of ground during the colonial period. We lost of, all the British government when the Britishers were using in the British Raj, it was totally suppressed, actually completely abolished. But the folklore medicine, the folk medicine in the villages were thriving, and that is why the traditional medicine is still thriving in India in spite of the British Raj and all the colonization of our country for the last hundreds of years. Our folk medicine has still survived only because it survived in rural population where our colonizers did not understand or did not pay much attention to what was going on, and they did not understand what was happening there, but they knew there was something happening in the urban area, and that is when they suppressed all these different colleges and training, but they could not do anything in the rural area. And that is why we still have these systems that are still flourishing in the rural area. Now we are realized, yes, there is some value here, and these are thousands of years old. And Siddha is another incredible system with herbal, mostly in the South India. Main headquarters is in Chennai. Unani was imported from Persia, still confined to the East. And this particular ministry is well funded and thriving. But the only thing they have not done is they probably should have included some integration with the conventional medicine. That was what was offered about 20 years ago. There was a course called GCIM, they call it, Graduate Course in Integrated Medicine. My sister is a graduate of it, where she is trained in both the traditional medicine as well as the modern medicine. So that was a very good combination. But for some reason they discontinued it, and that is something that should be addressed again. Now, the government of India has done another one, is called, they have put all of this knowledge together, and this particular site, I have given you that website there. It is called Traditional Knowledge Digital Library. This library is very, very important. It has got all the traditional medicine in one place. You can get it. It is in many different languages: English, German, French, Spanish, Japanese, as well as our national languages. And it is actually produced by the government of India. So it is a sort of a central repository of ancient knowledge, which is very, very rich. And this is to prevent biopiracy. Nobody can come and say, hey, this is my yoga. And that's what happened about 20, 30 years ago. This gentleman comes and say, I use steam and this is my yoga. And another one will say, I did this exercise and yoga together, and that is my yoga. So they will do this trademark. And they say, this is my thing, my thing. And that is not going to happen anymore because of this digital library from the government of India, where there are 200,000 formulations of herbal formulation and 1,500 postures that are used in yoga and other techniques. And the best book that has been sort of addressed, it is from one by Dr. Bhushan Patwardhan, and it is called Integrative Approach for Health, a Biomedical Research, Ayurveda and Yoga. Fantastic book. And this book was reviewed by one of my friends, Dr. Gundu Rao, who is an internal medicine professor of medicine at the University of Minnesota. After he read the book, he had only a couple of comments. It was so positive. He says, why are we waiting? Why cannot we adopt such an approach, integrative approach to healthcare? It is so impressive. This book is extremely impressive, where they have combined all of it and have this fantastic the integrative approach that are addressed in this particular book. But what is the one that is lacking, in spite of the thing I'm talking, is in any of our traditional medicine, we always look for a couple of things. One, does it work? Questions are very simple. Does it work? And is it safe? And are there some good, well done clinical studies? Because we are scientists, until those things are presented and published, we are not going to get convinced. Now, if you take traditional Chinese medicine, you have got fantastic safety data, fantastic efficacy data, and very good clinical studies have been done. And that is why traditional Chinese medicine is much more advanced and much practiced much more widely than Ayurveda. Ayurveda does not have that much many studies with safety data and efficacy data. They just claim certain things will work, but they don't have still these data. And some of the preparations they have side effects, because one of the main things that Ayurveda has been, preparations have been blamed, is metals, arsenic, lead, mercury, like that. So 20, but if you look at there's a list of around 270 Ayurvedic products. Only 20% have this heavy metal in them, but many of them are free of these metals, but they lack safety data. So these are the things that need to be done. Who will do it? We need to do it. So we, allopathic physicians who are actually trained scientists, we need to join our friends in the traditional medicine. Jointly we need to do this type of research, and then only you will have what we call as an evidence-based approach, of an integrative approach, which is evidence-based. And that's what Chinese have done very successfully. Don't worry about this. These are many. This just tells you how many types of patis and panchas and all that. Don't worry about it. Now, this is very true. Is what you eat is what you are. Very important. This is exactly is what we need to have, this type of following in our life, because this is exactly what happens. This is basically a lifestyle. Okay. And this is what I found in my friend's place. Before, I found all these different type of bottles on their dinner table instead food. So this is what is happening many times. Now coming to asthma, look at the choice of asthma treatments in India. Anything from inhaler techniques and biologicals, whatever you are using now, at the same time you are using it, there are parallel practices of asthma where fish therapy is given, yoga therapy, Ayurveda, Siddha, homeopathy, all these things go on at the same time. So I personally have seen several of these camps we have done in different parts of the country. I have seen patients with fish therapy, which all of you have heard. Fish therapy is something which is being practiced by this Gaud family for about 150 years. This is the picture where he's taking this type of special fish called, I think, muriel fish or muriel fish, and they make a special paste. They keep that the composition of the paste a secret. They fill up that fish with that paste and put that live fish in the patient's mouth, and that wiggles and goes to the stomach, and where it is decomposed, and that whatever that stuff they put in gets absorbed. Somebody did some about 20 years ago. They somehow were able to get that paste and analyze it, and it showed some steroid effect. But actually, it was not a steroid. So what it was is, it is a substance which stimulates the ACTH, it actually promotes the natural way. It promotes the ACTH, and that in turn produces increased amounts of endogenous cortisol, and you get the steroid effect. Whereas compared to what we do, we give steroids from outside. We give prednisone, methylprednisone. We give, all our doses are empirical. We are giving tons of this every day in our practice. What we are doing is we are getting some good clinical relief. At the same time, what we are doing, we are shutting off the ACTH mechanism, and that is the main reason why we have so many side effects. So this is something we could learn from these practitioners, is to go through ACTH, where you will go through the natural way. You still have significant steroid effect with very little side effects. Now, these patients I've seen did not have much of the steroid effects, even though they were on this type of therapy. Acupuncture is also used. I don't know a whole lot of it. No conclusions can be made because of methodological variability. Now, I can talk a little bit about yoga and asthma because I was involved in it. Now, yoga is a type of modality where there is a significant mental aspect as well as a physical aspect. It is the mental aspect which is very important, to have that state of mind which is steady, calm, but not very easily done than practiced, very difficult. But these asanas, these movements, are the ones that helps you to have better muscle tone. At the same time, builds that practice of concentration. You are every time you're breathing, and you're timing it with breath, with in and out, inspiration, expiration. And every time you inspire and expire, you are able to concentrate on the breath as well as concentrate on all these different movements. So your power of concentration increases significantly. So when the concentration increases, what happens is your awareness increases. When the awareness increases, your minds get sharp. Minds get sharp. And this is what happens when students now, yoga is introduced in all schools. Why is yoga introduced in schools? Is not to become, not to make them physically very strong, but mentally strong, mentally able to concentrate, mentally able to increase that absorbing capacity by concentration. And that is the whole beauty about yoga, is concentration. Concentration, very important, and increasing the awareness. And when we did this particular type of yoga, breathing techniques and all that, which I'm not getting into much detail, we found that they were beneficial. This was the first control study done in North America, in a university setting by our group in Fort Collins, Colorado. And the story goes that there is a big yoga university in city of Bangalore near Jigini, by one Dr. Nagaratna, Dr. Nagendra, and Raghuram. These are the three principals I know. They approached me. This is like 35, 40 years ago. I don't know. I don't remember. And they wanted me to take them to National Jewish Hospital to see whether the Jewish hospital will be interested to do some sort of a clinical study with them. And I did take them, introduce them to the medicine people. And within 15 minutes, we were out of the office because Jewish hospital was not interested. They were not interested in the 80s to doing, they said our leadership and all that, we are not interested. So the yoga university approached me and said, can you do it? Because you also have the same setup here, and you have the university, you have all the patients. So we started doing these studies, and we had our own group. We had a statistician, we had a person. We did about 8 different studies, published 3 of them. And one of them is this yoga, the clinical study of yoga techniques in university students with asthma, a control study. What it showed was very interesting. At the end of this study, what we found, these patients who had doing these yoga techniques had a significantly positive attitude. By having a positive attitude, they were able to handle their asthma much better than the non-yoga group. This was a control study. And they were also able to reduce some of their medications, especially beta-adrenergic agents. And this positive feeling, this positive approach actually made their asthma control better. And it is only good in mild to moderate asthma and as an adjunct. So our conclusion was, yoga will introduce a sensation of wellness in the presence of illness. So the patient comes to you to see, can I feel better? I want to feel good. I want to feel better. That's all they want that. They are not worried about lung functions or blood work or blood count or eosinophil count. I just want to feel good. I want to feel better. And that is what yoga is doing. They feel better. But if you measure their lung functions, it's still abnormal. You measure their skin reactivity, they're still significantly positive. So what it means is, in spite of the disease, they still feel good. And that's what yoga does. That was our finding. Now, further studies have been done in yoga techniques. And now I just read recently, not only it has been done at the patient level, also at the tissue level, at the molecular level, and they have shown that inflammatory mediators are also decreased in yoga techniques because sensation of well-being or sensation of depression actually influences your T lymphocytes. You know that. You are all immunologists. You know that. So when the T cells are functioning better, the B cell work better, and the inflammatory mediators become less. So that's probably what it is. So anyway, this is an interesting type of thing. It's a benign technique. This is something that could be used now. Amazing thing is National Jewish Hospital has hired a person teaching these techniques in their institution for the last 5 to 8 years. This person is teaching. So National Jewish Hospital is using these techniques. And also these techniques have become a part of the pulmonary rehab. They don't say yoga techniques. They say these people came and approached us, and we taught them some of these techniques, the diaphragmatic breathing, how to breathe well, all these techniques, the Kapalabhati, all those things we taught them. So, yoga breathing techniques will not replace anti-asthma medicines. It may reduce it a little bit, but acts perfectly as an additional complementary therapy. And more than anything, it gives a positive psychological overlay, improves wellness without removing illness. Allergic rhinitis, they use it, but the techniques are very difficult. It's not practical, but it does seem to help. And Jalaneti part, or the saline irrigation, is used widely, and it has got pluses and minuses. But one of the big pluses about it is overall, it is a good pulmonary, it's a good, it maintains good hygiene of the respiratory, right? A good respiratory toilet. Another thing what it does is it removes the crust of mucus and removes probably the mediators that are sitting there and restores the mucociliary function. By restoring the mucociliary function, it is a huge advantage, because when you have allergic rhinitis or any type of rhinitis, your nose doesn't function. What is the function of the nose? The function of the nose is not to smell. Function of the nose is to prepare the air for the lungs. The nose will warm, humidify, cleanse the air, and makes the air clean. It will slow down the air, and that pure air, which the time you inspire, the air reaches the throat, all these things happen. And because of this incredible mechanism nose has, all those mechanisms are restored by this simple saline irrigation, by improving the mucociliary function, removing the mediators, removing all those crusts. So the nose functions better. When the nose functions better, what other functions better? Lungs. Only when you do nasal breathing, when you are able to take in clean air, where the lungs work better. If you will lose all these protective functions if you breathe through the mouth. The mouth breathing will not protect it. It is actually all the dirty air, polluted air enters through the mouth if you are doing mouth breathing, but the same polluted air is cleansed and warmed and humidified, and clean air enters your lungs if it is all working well. And that is the importance of saline irrigation. Now, let's talk a little bit. I'll go a little bit fast here. Herbs in both China and India are world leaders in herbs. You know, they are thousands of years old. They have thousands of medicinal plants. So let's talk a little bit about traditional Chinese medicine. There is a product called Ashmi, ASHMI. It has got about a couple of herbal components, about 3 or 4 herbal components. But look at the bottom. When they did the study with this Ashmi, which is a traditional Chinese medicine, in this group, what they found, it was like a well-conducted clinical studies with control studies, which showed improved FEV1, improved symptom score, and very good safety and tolerability. So all these different Chinese farmers, they have done safety data and efficacy data. And this is the summary of the herbal component. Let us not go into that much. Then, what is the effect of Ashmi on inflammatory mediators that also look encouraging? With Ashmi and prednisone, it works as good as prednisone by reducing the mediators also, IL-5 as well as interferon gamma. So it works as good. Now, looking at after 4 weeks, the prednisone. So Ashmi works quite well, almost as good as steroids. And the summary of another one, which shows on refractory asthmatics, also shows quite encouraging. So this Ashmi is called Phytocart, anti-asthma herbal medicine intervention. There are 3 herbs in it, exact mechanism, whatever we know, I just told you, and no adrenal suppression, almost as good as prednisone, no side effects of prednisone, steroids. So this can carry some contaminant like mold, but it is actually a published data from American Academy of Allergy. Now, there is another herbal preparation which has been reported to block anaphylaxis. And this was done in mice and also being, human volunteers are also enrolled. But for some reason, I have not heard about it in the last few years. And this work was done at Mount Sinai Hospital in New York. So they took these 9 different herbs. 4 or 5 of these herbs are present in your own kitchen. And they mix it, I don't know what proportion, and they fed it to these mice. And this mice was already sensitized to albumin. And when they had fed this FAF2, FAHF2, that is the formula, FAHF2 formula 2, this blocked anaphylaxis. So this is the one drug that can and completely block peanut anaphylaxis also in mice. So this actually has been published by Dr. Srivatsava in the Journal of Allergy and Clinical Immunology. Very impressive type of thing. We do not have such drugs in Western medicine. There is not one single medicine that can block anaphylaxis, but herbal medicines do. So why did it not come into the market yet? I'm not sure, because sometimes we have some wonderful discoveries that do not enter the market, mainly because of economics. If the company doesn't make enough money in it, they probably will not bring it. So I'm not too sure about this issue, but this has been shown to be extremely promising. This already I have talked about it. There are herbs for allergies. I'm just going to mention a few names, that's all. Butterbur, chili pepper. These are published data again in Annals of Medicine. It desensitizes the nerve fibers, reduces the hyperresponsiveness. It's used as well as Tylo for cardiphilia. These are all different names, herbs for allergies. So that just to message is these are available. And again, cetirizine, this butterbur is another herb, and it works as good as cetirizine. Pycnogel, Albizia, Lebac, these are all mast cell stabilizers, which are useful in asthma. Pycnogel is a plant chemical derived from the bark of pine tree and rich in bioflavonoids, adjunct therapy for asthma. Again, published data. Tylophora indica is a very old one. Indian ipecac is used in India for many, many years. Mohang or ephedra, your grandfathers used it. And herbs, the tura plants, has been found for a long time. With garlic is pushed as a incredible herb preparation for so many different diseases, and still needs a lot more research. Ginkgo biloba improves PFT, anti-inflammatory. wild cherry tree bark for asthma, dry cough. So all these things have been used for hundreds of years, but this is something you need to be aware of. And this is about Ayurveda basics. I'm not getting into that much. So, what I'm trying to show you is not everything works. There is not a whole lot of evidence to support chiropractic manipulation. Homeopathy also has been pushed, but I did not find very good supportive data for that. I could not find much. So, overall, if you look at it, this is where we stand still. There is nothing like a grade type of evidence. There are a couple of B's, couple of C's. So this is something that is where the strength of recommendation for complementary asthma medications are the alternate medicines in allergy and asthma. It is so right now, this is where it stands. But can it get better is the question. Homeopathy, I'm not too sure it works that I don't know why. Well, I'm sorry, I went backwards. Sorry. Now, conclusion. Now, with this type of approach, what is necessary now is more research. So I have presented you sort of a mumbo jumbo type of uh, data here. Some good, some not good, some promising, some not very promising at all. Some look almost dangerous. So our job is to see whether we can do some sort of a joint research with our colleagues to see whether we can have some sort of an integrated approach where there could be some promising products right available right here. And the best people to do research are people like you who have got a fantastic baseline knowledge, and you're all scientists, and you are the right people to do this type of research and clear this cloud that we are having in our own country. And Chinese people have done it, and they have done efficacy data, safety data. We have not done it. Ayurveda still lacks it. So this is something that need to be taken at different levels of your training and your practice in medicine down the future. And thank you very much. So can I stop here?
Yes, sir.
Don't know, should I? Any questions?
So I don't think there are any questions that have come about, but quite an interesting talk. So, you use any complementary
Let me stop the
alternative?
share. I can hear better. Yeah, go ahead, go ahead. Uh-huh.
So I wanted to ask, do you use any complementary alternative medications that you prescribe in your practice?
Do I use it?
Yes.
Yes, I do. I use two things on a routine basis. I use the Jalaneti like many other people, nasal irrigation. I do have a team of yoga teachers. And teachers are very crucial. We have them teach these different techniques because majority of our patients do not know how to breathe. So
Mhm.
we teach them how to breathe right. So we use yoga teachers, and yoga teachers can also teach them about Janleti. And sometimes they come to the office and show them the techniques, or they go to those places. And these are that is what we use at this stage.
Okay. And any specific yogas that you prescribe so that we can possibly ask our patients to
There
do?
are certain techniques that are used in yoga, and it depends on the teacher.
Okay.
Every teacher has some difference. So I cannot say this is exactly the composition that they use. So, but there are books on yoga therapy, which the published by that group in Bangalore, where there is that yoga university in Jigini. So they have a book called Therapeutic Yoga. There's a small, like a handbook, in which it says what are the different types of yoga techniques that are used for different diseases. The important thing is we should not make these techniques very complicated. One, it should be used by anyone, and the important thing is it should be taught properly by a teacher. And after that, they can use their own. After that, they can practice on their own every day. It should become like a habit, just like you brush your teeth, you do yoga. You don't have to tell anyone I'm doing yoga today or something. so it becomes their lifestyle. So change the lifestyle, and this has helped not just allergy and asthma. I know people whose their outlook in life has gotten better, their diabetes have gotten better. So many people who have got positive type of attitude, even their major diseases, cancer and all those people, they start feeling better. In my own relatives, I have seen this happen. I cannot have everything scientifically um, based, but improving somebody's feeling about how well-being, sensation of well-being, which actually improves our immune function. I feel it is very, very important. Sensation of well-being. Actually, I was just in um, where was I? At Visakhapatnam just last week. I had to do a talk. I talked to the pediatricians and a group of doctors and all that. Then after everything, I was approached by a lady, young lady, a neonatologist approached me. I don't know how. And during our discussion, I might have talked about some yoga and all that. And she said, I have my own child. He's only 7 year old and has been diagnosed as diabetes type 1. And she said, I started reading about all these different techniques. Her blood sugar was about 500 and all these different parameters, and started doing these techniques. For the last 3 months, she's off of insulin, and she showed me some pictures, and it is just amazing. I don't know, I cannot say how it works, but it's working for that lady. And she's a well qualified neonatologist. She's just like any one of us, and that is her own child. So I think what it tells us is, it gives you a message. We should have an open mind, and open our eyes, and look at it positive. Let's look at it and try to explore what is here, rather than canceling it off. Because I still believe, for 6,000 years, people cannot be fools. Okay, you can be fool for 1 or 2 years, but not for 6,000 years. Okay, they are extremely intelligent people. So it's very, very important for us to open up and consider this opportunity that you have right in this country. This is the birthplace of Ayurveda. Chinese have done it.
Yeah.
Chinese have done it in their place, and it is our duty, a great opportunity for us to look at it, because we
There,
have the technology, we have the knowledge.
yeah, there are a few questions, sir. How to marry the anatomy, molecular biology used in allopathy or modern medicine with concepts of Vata, Pitta, and Kapha classification in
I
Ayurveda?
can my my volume is not that great here in this in this thing. Can you repeat it, Kunal, again slowly, a
Yeah, yeah.
little loudly?
So the question is regarding how do you marry the concepts of Ayurveda with the concepts of allopathy, because they have different concepts when they define disease, and our system of classification is a little different. So how do you?
Yes, you can't completely mix them. What happens is, and actually, I myself and my son, who is a cardiologist in New York, both of us went. This is many years ago. We wanted to know, how does this Ayurvedic doctor practice, and how they practice is very interesting. When they take the history, they don't just look at, this patient, when we were there, came with his ankle pain, and the doctor was came to the ankle pain, but before that he wanted to know what time he gets up, what type of diet, what does he have for breakfast, then what does he do, what does he have for lunch, da da da. He has got the whole thing he takes. So it is a very, very holistic approach. So what we need to do is probably spend a little more time, or have an assistant talk to them about more lifestyle. That is very important. Just not give prescriptions. I think we need to start. You see so much of obesity now in India. 63% are obese. Lifestyle is not good. So you treat with inhalers, your lung functions get better. Does the patient get better? I don't think so. I don't think so. He's as sick as before because he looks at himself as a whole. We look at only PFT. We look at 1% of something and say you are doing better. Patient is not doing better because we need to have a different way of looking at persons than one test. Because in allopathy, what we have is we have all the machineries to measure illness, but show me one machine that measures wellness. You
A
have
great,
only,
yeah, yeah,
there's
great
nothing
point to
like that.
ponder upon, sir. There's one more question regarding what about nasya, oil or ghee application in the nose. So that
Which
practice
one?
of the practice of applying oil or ghee on the nose
Oil?
or ghee on the nostril.
No, not a good idea. Not a good idea. Because you can inhale it and get into some, what is that? You know that better, lipid pneumonia or something, it will go right into it is not a good idea. Not a good idea. Actually, even when you do this Jalaneti, there's a technique for it. You don't have to inhale it. You don't have to inhale it. Do not go and sniff it up. What you do is you have to just bend over and let the water flow. And you should never use tap water. You should use either saline or boiled and cooled water with some salt. And you just let it flow. That's all. And you go through one nostril, all of it will come out of the other nostril, and you're breathing through the mouth. It's a very simple technique. But there is nothing like an inhale, you just spray it in the nose. Don't do that. That is not the right spray. So, technique is very important.
Yeah.
Technique is not a nose spray. Jalaneti is not a nose spray. It is not like the Flonase spray that you use. That is not the way to do Jalaneti. It is a flow. Jalaneti is a flow of water through your nasal passages, and through that flow, it just loosens all this and brings it out from the other nostril. That's how it works. It is not a nose spray.
Okay. I think we are also about crossing the time. Thank you so much, sir.
Okay.
It was quite an eye-opening session, and we hope we now start managing patients' wellness rather than their diseases and become better doctors. Don't look at all other disciplines of medicine with a kind of suspicious eyes as we usually do, and see that there
But,
might be some evidence based
yes,
there
thank
also.
you. Thank you. I hope there will be some impact. Important thing is if you have an assistant who is trained in it, that assistant will be an asset for you because
Yeah,
doctors are too busy to do that. Assistant will do a lot of good things. Thank you very much, Kunal, and I appreciate bringing this very interesting group here. And you're doing a wonderful job. And I appreciate. I'm not able to attend all your talks. Sometimes I just listen a little bit, but a wonderful job. Thank you so much, all of you.
so much, sir. Thank you
Good night.
everyone for joining. A very
Good
good
night. Good night.